Okay, all right, here we go. Good morning and welcome to PD Active's 5th online speaker forum. My name is Todd Morrish and I will be your host and moderator this morning with assistance from Sue Stein-Black, who you also see there. We hope you are all staying safe and healthy and yet still active and socially engaged to the degree we can. Our speaker has a wonderful and lengthy, as you probably just heard, a wonderful and lengthy presentation for you all this morning, which we will try to get through in 1 hour, leaving us about 30 minutes of Q&A as we try to wrap this up by noon. But before I introduce our speaker, a little bit of housekeeping, and I'll try to make this quick. First, we always like to cross-promote our many PD Active programs. So besides PD Active's renowned support groups, we also offer many other classes and programs for people with Parkinson's and their caregivers and loved ones. There's Tai Chi and yoga and Pilates and meditation, and there's voice and singing and boxing and dance and more. So if you have tried one or more of these, then we ask you to please tag a friend or family member to join you on your next session. Please check out the calendar link on the brand new pdactive.org website. It's right there on the homepage. Just scroll down, the calendar is. We'll paste that URL into the Zoom chat tool now. Right now, you are all on mute, and we have a large group of attendees today. We're well over 150 registrants at this point, and I expect others to be chiming in as we move through this introduction. So this will make for a fluid presentation without a lot of distractions. Additionally, if you are new to Zoom's webinar format, you will not see other attendees in your Zoom window, only Dr. Subramanian and myself along with Sue. Important, this webinar will be recorded. It is being recorded right now, and we will post that recording to our PD Active YouTube channel in the next few days. And Sue can paste that URL into the chat window now also. By the way, when we post these bits of information into the chat window, you should feel free to grab them in a copy and paste them into an email or a Word document somewhere else so that you can have them for later. We will also try to publish them later as well, but if you want them sooner than when we publish them, grab them yourselves as they're pasted into the chat window. You may submit questions when you have them using Zoom's Q&A feature there in your Zoom tool tray on the bottom of your screen. As mentioned, we have reserved Q&A time at the end of the presentation to pose those questions to Dr. Subramanian. Sue and I will use the Zoom chat feature to relay information to you regarding the presentation, but we prefer you use the Q&A tool for questions to the doctor. That just keeps it all sort of located in one simple place for Sue and myself. Throughout the doctor's presentation, we will present you with a handful of poll questions, which will pop up on your Zoom screens. Please answer these as quickly as you can so the doctor may respond to these in the flow of her presentation. If you prefer not to answer the questions, that's of course just fine. Merely close the windows when they pop up. And if I can take a minute now, I think I will throw up a quick poll question right now just so the doctor knows who her audience is. And then I'll keep going with the introduction. So that's published now. Answer that at your earliest convenience. If for any reason Dr. Subramanian or I get disconnected from this webinar, which I doubt, please be patient and do not disconnect or leave the meeting for a few minutes as we try to get reconnected. It is possible that Sue may take over as host if I am disconnected, but I doubt any of that will happen. Fingers crossed. Finally, PD Active depends on donations to bring events like this to our members free of charge, and we remain super grateful for your contributions. If you have not yet had a chance to make the suggested registration donation of $10 for this form, we will paste that link into the chat feature now. Thank you, Sue. Okay, so here we go. Dr. Subramanian received her medical degree in 1996 from the University of Toronto, Canada. She did her neurology residency and movement disorders fellowship training at UCLA. She has stayed on at UCLA and is now a clinical professor of neurology there. She established the Movement Disorder Clinic at the West Los Angeles Veterans Administration and has assumed the position of the director of the Southwest PADRECC Center of Excellence in Parkinson's Disease. And that wonderful acronym stands for Parkinson's Disease Research, Education, and Clinical Care. She has developed a strong interest in integrative medicine, which we will talk some about today, with a special interest in yoga and mindfulness. She underwent a 200-hour yoga teacher training and studied mindfulness at the VA with J.G. Sherpa, and Christian Wolf through Insight LA. She is designing a yoga teacher training program for yoga instructors who are interested in working with PD patients. Dr. Subramanian recently got board certified in integrative medicine. She is also passionate about palliative care and PD And here is a link to her story on the Parkinson.org website. Sue can paste that in the chat board now. She's collaborated closely and often with Dr. Lori Mishley, whom many of you got to know in PD-Active's January speaker forum. And finally, Dr. Subramanian is the host of a virtual support group with world experts in PD, and here is that link. Phew, that's quite a background. Dr. Subramanian, welcome, and thank you very much for taking time out of your weekend to speak with our community.
Sure. Yeah, pleasure.
I'll hand the figurative mic over to you now, and you can take it away.
Great. Okay. Well, thank you so much. Thanks for having me. And I know it's a busy, crazy weeks and days and lots of running around. So, so we will, try our best to teach you a little bit about my passions for Parkinson's and answer some general questions. It'll be hard for me to answer any specific questions, related to your specific disease symptoms or, medications and stuff, but we'll try to keep it general and we'll kind of go from there. So I'm going to try to share my presentation here. Let's see if that works.
You should be able to now.
Okay, cool. So my talk is a little bit maybe different than what you may have heard from your average neurologist out there. Did that work? Yes, I think hopefully you can see this. And let me close a couple things here. Okay, so just getting started here. So hopefully you can see that means
that's good.
Perfect. Okay, so I'm going to be talking to you a little bit about living well in general with Parkinson's and fostering this sort of social connection in a time of physical distancing. So using a little bit of the COVID sort of situation to talk about wellness strategies, and hopefully some of this will resonate with you. So I wanted to tell you just about a case study that maybe you see a little bit of yourself or somebody you know in this case, and we can kind of think about sort of this as a framework for the rest of the talk. So John Smith is a 75-year-old veteran with a 14-year history of Parkinson's disease. Judy has been married to John for 50 years, and they have 3 adult children, 2 of whom live nearby. Judy has enjoyed playing with their 4 grandchildren, ages 4 to 10, on a weekly basis. Judy has helped to clean her home for 4 hours per week and visits with a friend, while John has physical therapy sessions once per week for an hour. Once every 2 weeks, Judy leaves John with one of their children to get her nails or her hair done. John has had a decline in his memory for the past 3 years. He's had a tendency to fall once per week, and occasionally he sees things that are not there. Additionally, John's had some depression and anxiety for the past 5 years, and he's had significant apathy. Judy tries to motivate him to exercise or to visit with his fellow veterans at the VA. He's had insomnia and some urge to urinate 3 to 4 times per night. Since COVID-19, Judy has not been able to see her grandchildren or her adult children except for a socially distanced meeting when her daughter brings her groceries once per week. They have not had any physical therapy or exercise classes. They have not visited the VA except for visits to the doctor that they've been doing virtually, but not physically come into the VA. They've largely watched news of the COVID crisis for many hours at all times of the day and night. John's anxiety and depression have worsened, his insomnia is worse, and he's more confused. John's been napping in the day and is up at all hours of the night. He's been worse with his compliance of his medications. His balance has been worse, and he's had some near falls at home. Judy's also having some anxiety now and is finding it difficult to sleep at night. She's exhausted. She's been drinking more wine than usual every night. She worries that if something happens to her, there will be no one to take care of John. So this is, a pretty average patient that I see at the VA. And I just want to clarify a few terms and tell you about some interesting research and some new thoughts that we're sort of focusing on trying to help our patients. So apathy is really a symptom that's very common in Parkinson's. 40% of our patients get it. And it's really about having a lack of motivation or interest. And the patients will describe this sort of diminished goal-oriented behavior. Sometimes there's a dampening of emotional expression. It's very different than laziness or depression. But caregivers will talk about, the patient looks like they don't care, they're not starting or finishing things, that they're very quiet, they seem bored, they sit alone all day, and that they do nothing. There's a lack of enthusiasm or couch potato. So I guess there's some poll questions here. So PD patients, have you experienced any of these feelings in your PD journey? PD patients, has your PD doctor ever asked you about loneliness? These are 2 questions that maybe you can answer as we go through this. So with that case scenario and some things that we had talked about before the pandemic, Dr. Mishley and I have this large data set that we follow. She's followed this some patients over, I think, 8 years, 7 years in this data set. And we'd love to have more participants. And it's basically a study run out of Bastyr. I think she probably gave you some links. It's called the CAMCARE study. So we ended up having this research published, and it was actually research that looked at data from before the pandemic, but it really became in the setting of the pandemic very, very important to care about this. And we've been using sort of the current situation to really educate around some unmet needs that were there in our population even before. So I wanted to sort of teach you a little bit about loneliness and its effects on the nervous system and health in general. So we know that in the background that it looks like many people have had apathy, depression, and loneliness, and few of them have been asked about the loneliness issue. So that's good to know from the poll. Social isolation really is not good for your health, and we know that social connection is like a basic human need, just like food, water, and shelter. And really, I think as a society, we've underestimated the need and the importance of this. In general, in aging populations, social isolation is as bad for you as smoking a half a pack of cigarettes a day or being obese. And in veterans, there's been a lot of attention to suicide prevention. And in our population at the VA, we really do care about this social isolation issue because it actually is a risk factor for depression, anxiety, and substance abuse, but also suicide. And really going into the pandemic and before, really, we had very little data on this issue in Parkinson's. And so Dr. Mishley and I decided to look at this, and we'll tell you a little bit about our study. So just defining things, so social isolation is something that you can actually measure. So we can see, how many people are in your home or how many people you actually interact with on a day-to-day basis. But loneliness is sort of more of a subjective feeling. It's really this feeling that you desire certain relationships in your life, and the relationships that you have are not meeting what you desire. So there's sort of this gap between what you have and what you really desire, and that's really what makes you feel lonely. And what I learned in this research is that one needs actually relationships in 3 different spheres in order to not feel lonely. So there's this intimate sphere in which you have a partner maybe in your home, and they fulfill this emotional connection. Then there's a relational sphere of loneliness in which you have some close friendships or social companions, perhaps a group of friends in your tribe, maybe some friends that you meet up with that have, might be neighbors or something, or some other friends that you might have a coffee with once in a while. This sort of fulfills this relational loneliness issue. And then there's more of a collective loneliness where you feel connected to a group of people in society. And for many of our vets, it's being a veteran. Perhaps for our Parkinson's patients, it might be being connected in a group like this, and you really have like-minded purpose and interest in it. And this is sort of something that is connecting you. And I think what I was interested in finding out about is that you actually need connections in all 3 of these spheres to really satisfy these various relationships in your life and to not feel lonely. And so one can look like they're happily married. I can see a patient across from me in a Zoom visit or in my office, and they have somebody who looks like they're answering their questions and they look like they're connected, but that person can still feel lonely because they don't have these other unmet needs of these relational or other sorts of situations connect with the collective loneliness being addressed. So loneliness in general can affect a number of issues just in your health, and these can have direct impact to Parkinson's patients. So stress is buffered by social connection. Social connection also helps your immune function. It can also help your cognitive function. And when you don't have social connection, people can actually become hypervigilant, and they can actually fixate on things that are more socially threatening rather than their pleasant ones. So people tend to fixate on bad things in their environment when they're not connected to the other people. It can also disrupt sleep. And as you know, many of our patients already have issues with sleep. And so there can be this sort of downward cycle that we'll talk about that can really disrupt many aspects, from cognition to immune function to stress regulation, as well as sleep in our patients. There's reasons even before the pandemic that our patients were at risk for becoming socially withdrawn. I think that many Parkinson's patients will say, I have a tremor, I don't want to go in public, my dyskinesias get bad, and I feel like I don't want to go to dinner with my family. Sometimes the non-motor issues of apathy, depression, anxiety, and fatigue can be barriers for wanting to socially engage. patients sometimes have to worry about, needing to find the restroom fast, or even the perceived stigma of having Parkinson's in general have been reasons that patients have said that they don't really want to be as engaged in their communities. And so I think, going into the pandemic, we already had concerns, and this is why we looked at this cohort. So we had about 1,700 patients with Parkinson's, and we did various sort of questionnaires on them. This was really a questionnaire designed, as Dr. Mishley, I think, has presented some of this data to understand what diet and exercise can do. But I was sort of interested in some of these issues around social connection. And so we looked at things like, these 2 promise questions about how satisfied you are with social activities and relationships, and how well you carry out your usual social activities and roles. And then there was questions about, I am lonely and I have a lot of friends. And I think, we just had a question that was in this poll here that showed that a lot of you are lonely, and or have not been asked about this. So I think, this is something that is an unmet need in various groups that I've talked to. So when we looked at quality of life measures in our cohort, we were kind of surprised because we were looking at things that were modifiable that could affect quality of life. And we see here, something as obvious as a tremor, a lot of patients will, say, this is something that defines my disease to me, but really that does not seem to affect quality of life very much. And it's really things like, I am lonely, which really translates into a poor quality of life. And with the flip side of that, I have a lot of friends seems to really bode for a better quality of life. And when we compare this to other modifiable variables in our data set, a lot of us, and Dr. Mishley as well, talk about exercise as medicine. And so we're really trying to push our patients to get exercising. I know you guys have some events in your own sort of group here that around exercise. And so, we look at things like the benefits of exercising, and it looks like the more exercise you do, the more consistent you are doing it 7 days a week for 30 minutes a day, really can affect, how good your, measures are from a motor. And we have these measures called the Pro-PD that look at our scales of how people are doing with their Parkinson's. And really this, the exercise measures are very beneficial. But what is interesting is that the loneliness measures are as bad for you as the beneficial effects of exercising 7 days a week are good for you. And so when we think about populations at risk, people who may be isolated in their home, may not be exercising, it's sort of a double whammy. But sort of to pose it in a positive way, connecting in a group like this, maybe exercising in groups, it can really be a double benefit as well. So really sort of thinking about things that we can modify. So we had ways to look at various sorts of symptoms as well. What types of symptoms seem to be more common in patients that are lonely? And we see here with this light blue line here that lots of non-motor symptoms seem to be associated with being lonely. So things like fatigue, things like lack of motivation, things like depression, anxiety are much more common in the lonely cohort. And it's hard to know whether that makes them not engage as much or if the loneliness affects their non-motor, but they do seem to be associated. And you can also see that the motor issues are also more as well, but it really is these non-motor issues that are very, very high in lonely populations versus this blue shaded area is the, what we call the maple leaf diagram here, is, much less symptoms overall in the non-lonely population.
And, and Dr. Subramanian, I guess the interviewees or respondents in that survey were self-declaring as lonely or not lonely?
Yes, those were questions of I am lonely or I have a lot of friends. Those were the 2 questions there that we were asking. So in that one, it was just I am lonely versus I am not lonely. That was like a true false. So yeah. And so really going into the pandemic, we had this growing knowledge with this database of patients. So we saw that, loneliness really did not, this really was a modifiable, potentially modifiable risk factor that boded poorly for outcomes in Parkinson's patients. And then we had this, COVID-19 pandemic as well, as the sort of sense that we are, going into higher rates of Parkinson's. Parkinson's disease has doubled in the last 40 years and then going to double again in the next 20 years. And so there's really been this 3 pandemics that we're kind of mixing synergistically to, really be concerning for our patients. And so we really wanted to sort of see how can we proactively address this. So looking at a few things. So this slide was had been accompanied by a drawing. There was a paper that came out early on in the pandemic, looking at things that were concerning to our Parkinson's population, given the, the sort of shelter in place and social distancing kind of restrictions that were in place during the pandemic. And so really this, I think this was a cartoon illustrated about the work of Boss Blom and some other folks. So the concern was that patients were getting socially isolated, there was increased stress, increasing levels of physical inactivity, all kind of working together to make worse symptoms, make cognition worse, and really sort of what were the sort of things that could rescue those sorts of issues were things like socializing online, mindfulness interventions, and then home-based online workouts and things like that. And so this was something that was proposed early in the pandemic. And really, when we wrote our paper and we were looking at a similar way to kind of intervene in this sort of at-risk population. So we had social isolation leading to increased stress issues, leading to increased immune issues, increased disrupted sleep, as I showed you. And then, the worry that this was going to worsen motor issues and non-motor issues in Parkinson's, leading to more apathy, anxiety, and depression, and leading to even more social disconnection. And this sort of worry that this could be a downward spiral, we proposed this sort of intervention of social prescribing, which I'll describe to you now. So really, we talked about educating clinicians on how important it was to ask about social health and asking patients about loneliness. We've since come up with a few screening questions that seem to be beneficial from the loneliness questionnaire, the UCLA loneliness questionnaire. There's again, the sort of notion that you have an at-risk population, so we have to proactively ask them. They're not going to necessarily come to us in clinic and say, I'm lonely. We have to ask patients at every point of care. If you're meeting with a social worker, if you're meeting with your primary care doctor, if you're meeting with your Parkinson's doctor or a psychiatrist, all of us have to know about this and know to ask about this proactively. And then for our patients, for our clinicians to be able to know about what social prescribing is. And so what social prescribing is literally taking a group of at-risk individuals and then trying to prescribe them, as I would a pill or a surgical intervention, some social support. And so plugging patients into things like a support group like this one, or having people get proactive phone calls and things like that, so sort of reaching out and then seeing if there's ways to connect people. So I think this is sort of a kind of a novel sort of thing that we've been talking about, but really something that I think fits quite well into the area of integrative medicine that I've been kind of fascinated by in the last few years. And I'll just give you some updates on that, and then we'll talk about sort of my tips from a lifestyle perspective. I know you've had some other speakers that talk about this. So yeah, maybe in the meantime, you can talk about integrative medicine strategies that you might have tried. So in the meantime, I'll define integrative medicine. So integrative medicine is this medical system that integrates aspects from other healthcare systems into the Western approaches. So really, it's sort of this kind of a different thought on how health is defined. So historically, health is defined as an absence of disease or infirmity, but really, the WHO, which is this World Health Organization, has defined health as a state of complete physical, mental, and social well-being. And so it's not just sort of just the lack of disease. It's really sort of a more holistic approach to a lifestyle-oriented kind of approach where, I think many people can identify some Eastern practices in sort of lending to helping with these sorts of approaches. So I'll touch on this a little bit more, and then we'll talk a little bit about what types of strategies may be helpful to Parkinson's patients in this, and then we'll kind of go from there. So what a lot of our patients had talked to me about before I really had studied integrative medicine was sort of sense that they didn't want to take so many pills. They wanted some guidance about wellness strategies. A lot of my patients at the VA would come in, or even at UCLA, and say, Doc, I Googled this and all this stuff came out and I don't know what to believe and what not to believe. And do you think this is just a hype about this, or should I try this supplement, or should I try this, hyperbaric oxygen therapy or whatever? And I think, a lot of patients were feeling like they wanted something different than what the standard Western approach was, but that they really had a very little idea of how to sort of go through all the barrage of information out there. So it looks like most people have done some integrative medicine strategies. And now that maybe we've we redefined integrative medicine. Maybe people can retake that poll. I'm not sure, but yeah. So I think that there's sort of been the sense that patients want a little bit more customized approach to what their needs are. I think there's been issues with gender that have not been addressed, some issues with disparities in care from different ethnicities and race, and different sorts of things. So I think the standard Western customized cookie cutter approach has not served many populations. So I was thinking that it would be good to learn a little bit more about these sort of other things that affect health, and the social determinants certainly can be part of it. I think also patients have been come to me and said that they have a hard time communicating their interest in some of these other sorts of approaches to other providers, and they wanted some guidance as to how to do that. So I think out of the gate, I think it's important to realize that not every treatment that's out there is, safe. And so I think I definitely, with my Western medical hat, would say, that you should be aware of treatments that are touted as cures or miracles, treatments that are only available outside the US or Europe, things that seem very expensive or profit driven, things that are only really you're seeing on an infomercial, the internet, TV, or social media, and any treatment that asks you to stop your standard conventional treatments, I think you have to be a little bit worried about. So I'm not about stopping levodopa. I think, Parkinson's medications, certainly Sinemet has a really important role for restoring dopamine, which is a chemical that's missing in our patients' brains. And so I don't tell people to stop levodopa, nor does Dr. Michelin, even though she's a naturopath. And I think we totally agree on many aspects of care. We understand what we do well in Western medicine, and a lot of the places that we're drizzling in integrative approaches are really in these places where we don't have good treatments. So just a few more safety things. So it's important that you realize that if you're taking supplements and herbs, that many of them may interact with other medications. For example, St. John's wort can have drug interactions. They're still metabolized by the liver or kidneys, so they can affect organs that are important for metabolizing other medications. Some of them can be toxic if you take too much. For example, vitamin C can cause neuropathy symptoms. They can have side effects that may be harmful to the sort of symptoms that you have. So, for example, some patients have asked about, cannabis, and it can affect apathy, it can affect sleepiness. And so it's important to realize that these things, even though they're herbs, can still have a number of side effects. It's also important to realize that, even though certain things are touted in certain medical systems, for example, turmeric has had some, attention in other healthcare systems. And it's important to realize that a lot of those systems are in a holistic diet plan under a system. So in Ayurveda, you eat, things that are in season, and you cook, for example, turmeric mixed with ginger, black pepper. You use fat to cook these things in curries and stuff. And so just taking that powder and ingesting it is probably not going to give you the benefits of many of these other sorts of systems. So really important to sort of think about this. And it's also important to realize that they're not regulated by the FDA. So here's another poll question. I'll let you guys answer that. As we're going through this, I'm just going to touch on a few trials and research that we have. So there's been some studies on acupuncture. This is a study by Ben Kluger. He was in Denver at the time he did the study. And this is a study looking at fatigue and acupuncture against sham acupuncture points. And the interesting thing about this study was that both the sham acupuncture points and the real acupuncture points both actually improved fatigue. And so there is some issues with really blinding and doing good studies with some of these sorts of treatments, because I think, just being with a practitioner that you trust in a certain therapeutic environment sometimes can help our symptoms. This is a study on acupuncture in treating pain. This is a small study out of the UK, and it was interesting, small beneficial results here. A lot of studies still to be done in this field. This is a study on mindfulness yoga versus stretching. This was a study out of, I think it was Hong Kong, and it looked like it actually had some good beneficial effects in this relatively big sample size of 138 participants. And in this study, there was actually benefits in many of the non-motor issues, so anxiety and depression, which is exciting. I think a lot of the times when we do these studies, we're spending a lot of time talking about motor issues, probably not enough time looking at the non-motor benefits of some of these other practices. So some exciting preliminary results. Here's a study looking at Tai Chi, and in this study published in the New England Journal, it's actually an older study from 2012. There was benefits in balance. So I think we have some small, studies here and there that are starting to crop up that are, showing benefits against, and it's hard to do these studies. I want to be honest. I'm currently trying to work with, designing a program for yoga teachers to work with Parkinson's patients. And a lot of the issues that we have with just giving a pill and blinding it against a placebo, when you using these other interventions can be much more complex. So other things, I think it's important, just as somebody who's open-minded to these, to communicate with all your healthcare providers. So if you're taking a new supplement or herb, definitely put that on your list and give that to your doctor. The pharmacist should also be aware. Make sure that all your healthcare providers are in their loop about what all you're doing. It's also important to weigh the risks and benefits of any treatment, with the various doctors that you have, and be communicative. I think if doctors are out of the loop, it's often very hard for them to weigh in, and the less communication, it just ends up forming barriers with the therapeutic relationship. So I would definitely urge you to engage, the doctors that you have, and give them sort of a sense. So it looks like a lot of people are into yoga, which is great. That's one of my favorite therapies.
Doctor, I should inject here and just say that I sort of misdesigned this poll so that people could not choose multiple choice.
More than one. Okay. All right.
Still indicative and informative, because it tells us that the most common non-traditional approach that folks have tried is, of course, yoga.
Yeah, that's awesome. And meditation as well, which is great. So, and religion, I think is cool to, in some ways, list there. You might put that in a different approach, but that's really cool. So good to know. Yeah. So I think, just and talking to your providers, also knowing that some of these therapies can actually have effects on other things. So when you're trying something new, try to just add one thing at a time, so that you can gauge, hey, I've been going to acupuncture for the last 2 weeks. I didn't make any other changes, and I see this benefit or this side effect. So that, you're sort of just doing one thing at a time is definitely helpful. It's also important that you stay on your conventional therapy. So like I said, it's actually pretty dangerous to stop your Parkinson's drugs cold turkey. It's always important that if you're making any changes, that you inform everyone, that everyone's part of the dialogue. And so, certainly don't want to be, harming people and trying to help them.
And do you think 2 weeks is a good window in which to add something new to your regimen?
Often probably, I would say sometimes with certain types of things, 4 weeks might be better. So I think, the longer that you could just try one thing at a time is probably, helpful. So
as long as it's consistently applied, right?
Yeah. And keep a diary so you have a sense, because, sometimes people, if many doctors are changing many different types of things, patients get confused as to what is happening and what is not happening, sort of thing. So, so this slide might be a little out of order, but I wanted to just, talk to you a little bit about sort of this holistic approach at the VA, and sort of the VA has kind of been a cool place for me to practice, because I think that, they're actually quite open-minded to some of these sort of integrative medicine sort of therapies. And I think they just have some unique resources. So anytime I give a talk like this, if there are veterans out there, thank you for your service, and definitely love to get you guys connected. If you are a veteran with CARE and Parkinson Centers of Excellence, I run the one down here in Southern California, and we go out to actually New Mexico. And then there is a Center of Excellence at the San Francisco VA. It's called the PADRIC, is the sort of short form. And they have some great outreach as well, even to the Central Valley, lots of, and so a lot of it's being done on, I think, virtual visits. So you can, certainly try to get care. Basically, you have to register at the VA and then get a consult into that, those specialty movement disorders clinics. So yeah, so I think it's kind of cool just to think of this as a VA diagram, actually, where you have the patient in the middle, these different things in the circle around, and then sort of talking about, treatments and these other approaches, as well as including the kind of concept that the community in which, and the environment in which the patient is living in, including, social support and things like that, is actually part and parcel of healthcare. I think that's kind of a unique approach. And since I'm just, I think I meant to put the slide later, but I don't want to forget this. So we have this kind of cool way of social prescribing at the VA, where the people who used to come in as volunteers to the VA have actually been redeployed. Many of them were told that they couldn't come in, since the pandemic had started. And they actually, some of the volunteers actually got great personal satisfaction and benefits from being volunteers. And anytime you're a volunteer, there's actually a lot of mental health benefits and even physical health possible benefits as well. So they redeployed some of these volunteers in this program called the Compassionate Contact Corps. And basically, have matched volunteers with some lonely veterans. And so it's kind of a cool program that has been rolled out, and they're looking for volunteers. And also if you're a veteran who is lonely, you can also avail yourself of the resources. It just requires a consult through the VA portal. So it's pretty cool. I think that we're sort of doing some cutting edge things at the VA. So
the San Francisco VA program you referenced is PADRECC. So a search on that.
Patrick, yeah, they're all, yeah. If you go on the VA Patrick, or you just put VA, Parkinson's disease, it should come up. All of our Patricks, we have a Patrick wide website, and then you can click on each one, has a portal to get to the individual place. And then we actually have just started a partnership with the Parkinson Foundation as well. So a lot of our resources are on the PF website as well. So. Okay. So just sort of general approaches to, I think we talked a little bit about lifestyle and approaches. And so for me, I think, it's helpful for me to understand, I think the patients that do the best are the patients that have done some work in thinking about these sorts of approaches and are trying to incorporate them. So one is your sense of purpose. So I think it helps to have your own sort of definition of what your definition of being healthy is, what your purpose is, what brings you joy and well-being. And if you can communicate that to your healthcare team, it's very helpful, because I don't know that you want to spend time with your grandkids and that's your goal. I don't know that you want to climb this, mountain in LA or whatever. Like, if that's your goal, I think that it's important to have doctors that know about that, so we can kind of get you there. And, I think that those may change as the disease progresses. So revisiting that is definitely helpful. Some of the purpose that I've seen a lot of happenings around in the pandemic have been around activism. And I think, belonging, like I said, to this group of this collective belonging to Parkinson patient group is very helpful. When you feel like you're not alone, it actually can help your health a lot. And so this activism and advocacy has been kind of cool. So one of the things I urge you to do is read this book, Ending Parkinson's Disease. It was written by, these folks, and Mike Oken and I work very closely together on a lot of educating, and I'll show you a blog that we're writing. So they're really talking about this Parkinson Pact. If you read the book, you can spend a little more time thinking about this as well. And they have a campaign right now called Give a Dime about Parkinson's disease. There's also been a lot of, educational things around that. So you can take a look. I did a webinar with Bas Blom around this Ending Parkinson's Disease. And then there's a group of patients that are called the PD Avengers that have aligned in the pandemic. And really, they've sort of talked about, sort of different things that have really helped them in their activism, helped them in their Parkinson's. So I really urge you to, maybe become a PD Avenger if you'd like, and learn about their sort of goals. And we actually, I've been hosting this virtual support group series, as Todd had mentioned, and it's with the PMD Alliance. We've had a whole host of different speakers. We continue to do this, and I think we're about 80 speakers in at this point. And I've hosted a number of the Avengers here, and you can see, they have one about the origins of why they exist, and different sorts of things around advocacy. And I think it's really great when patients get together and find interests sort of, and can spend their energy kind of on this advocacy and activism. I think it really sometimes realigns a purpose and can really help people get feeling better. So other things that I encourage people to do: staying mentally active. So learning something new, maybe you're reading a little bit, trying to, stay engaged in things like a musical instrument. I see Todd's drum set in the background there. So definitely a big fan of, trying to learn something new. I've been reading a lot. I would definitely encourage people to look at this book Together, which is by our current Surgeon General of the United States. Talks about the loneliness stuff. I love Atul Gawande. He's another great writer. I'm just going to sprinkle in my favorites a little bit through the end of this talk here. Viktor Frankl, I love his work. I think this book is a total life changer for me, really talking about, the ability to change one attitude given the circumstance, and sort of, I think having that sort of ability to have, affect change in ways that whatever we can is pretty amazing. So this is a beautiful book. David Kessler's work has really resonated me with this year. If you've had loss, if you've been grieving this year, even the grief of, not being able to, have a normal life in the last year. So it says, this is a quote from him: "I did not want to stop at acceptance when I experienced some personal grief. I wanted meaning in those darkest hours. And I do believe we find light in those times. Even now, people are realizing that they can connect through technology. They are not as remote as they thought. They're realizing they can use their phones for long conversations. They're appreciating walks. I believe we will continue to find meaning now and when this is over. So I think, realigning some of our sort of attitudes and our way of thinking about why things have happened is helpful. And I think David Kessler is just a remarkable writer and really resonates with me a lot. So other things that are proactive that you can do: exercise. Exercise is like medicine. Just to put in a plug for yoga, and I don't want to belabor too much of this here, but mixing it up, more is better. Things that you can do in groups if you can. So I'll just highlight, skill-based exercise, aerobic exercise, resistance training, balance, mind-body approaches, and stretching. I think yoga ticks all these boxes, but certainly aerobic exercise is something that I think everyone should do if you can get your heart rate up for 30 minutes, at least 5 times a day. If you can 7 days a week, that's even better. Trying to focus on things that are skill-based is in resistance training helpful. The mind-body approaches, I'll spend a minute talking about that. And certainly in a disease like Parkinson's, where you get, stiff and slow, sometimes on one side of your body, stretching is hugely important. So,
Doctor, I have a quick question to interject here.
Yeah.
Would you in our goals of trying to get 30 minutes a day and 7-ish days a week of exercise, and exercise is medicine, would you count yoga in that 30 minutes?
Yeah, absolutely. Yeah,
So
of course. Yeah. Yeah, I mean, you can get the cardio that you need in yoga if you do it fast enough. But if you enjoy walking as the cardio and then you want to sort of do 10 minutes of yoga before and after, something like that, I think, or do 30 minutes one day of yoga and do more cardio a different day. But I think, again, anything that you love to do, you can mix it up. But yoga certainly ticks a lot of those boxes. So sleep is really important too. I think we spend too little time understanding the benefits of sleep and really emphasizing this. 8 hours a day if you can, or 8 hours at night if you can. It's really when you're going to cement memories and detoxify the badness out of your brain cells. So really important. The better cardio you get, the more sleep you'll get, the more restorative sleep you'll get. Really trying to wind down at the end of the day, shutting off the social media, shutting down the devices. Considering melatonin if you need it, especially if you're fighting in your dreams. Nutrition, I know Lori spent a lot of time talking about this, but just as a review, I really tout the Mediterranean diet, lots of fresh fruits and vegetables, healthy oils. If you can spice it up a little bit, because some of our patients lack sense of smell, and so spices, herbs, things like that are helpful to get people to taste the food better. High fiber, given constipation, color, colorful choices, lots of that kind of stuff. Hydration is really important. We probably don't spend enough time hydrating in general, especially these days when we're doing Zoom meetings all day, so 6 to 8 glasses of fluids is good. Free waters is fine and cheap. If you like coconut water, it's a good hydration. Gatorade can also give you more electrolytes, but certainly we don't want to take a ton of caffeine as the hydration, because it actually has a lot of diuretic effects. So, just moderate amount of caffeine, and really drinking just regular water is probably the best. The gut, a lot of focus on this. I won't spend a lot of time. Suffice it to say, I generally tell people to take prebiotics. So eating things like certain types of vegetables, like, onions and garlic and stuff, fermented foods, if you like those. I don't really spend a lot of time telling people to take probiotics or buy them. I think a lot of nutrition and prebiotics can just be gotten from a healthy diet.
Yeah, Dr. Mishley came out a little bit against the probiotic model too.
Yeah. And then supplements wise, I think, I don't really tell people to take a lot of supplements. I think that vitamin D should be checked and replaced above the level of 40. So I'm a little bit more aggressive with vitamin D. I think if you have REM behavior disorder, that fighting in the dreams, melatonin is reasonable. I think if you can, again, mix some of these things into your diet. So, turmeric can be added to curries and stuff and cooked and absorbed with fat, things like that. But I don't really spend a lot of time talking about extra supplements. Labs, I think it's reasonable once a year to just get screening labs. I know Dr. Mishley has a lot more labs that she says about, but I think B12, vitamin D, homocysteine, thyroid check, lipid panel check, hemoglobin A1C, which looks at diabetes measures, and then a bone scan once a year is probably reasonable, depending on your age. Spending a minute on mind-body approaches. So thinking about things like, mindfulness. It looks like a significant percentage of groups already doing that, but it might not be sitting on a mat meditating for 20 minutes. It might be, going for walks and appreciating, nature, getting out, maybe looking at the sky at night, being, a little bit introspective in these sorts of natural settings, spending time maybe journaling, maybe gratitude practices. There's a lot of different types of mind-body approaches. Yoga certainly incorporates a lot of this and incorporates a lot of the breath work as well. If you enjoy playing music, I think it can be a meditative experience, or listening to music. And then, singing, dancing, having some fun, art, there's a lot to be, said for all of these things. And then prayer. I think many people take a lot of, sort of peace from prayer. And so whatever you think, could fit into this, I think if you can incorporate some of that every day, it's definitely going to be beneficial.
These all could be listed in the non-traditional and integrative medicine.
Yeah. Yeah. I mean, all of this kind of, for me, it's not just, this is this here and that's there. And, I think it's all just a lifestyle approach. It's my way of practicing. It's my way of honestly living too. So I don't really think like now I'm taking my pill for my allergies and, or like birth control, like it's all just sort of mixed in. So I think
hence the title holistic, right? I mean, you want to think about this as a lifestyle, not a series of medications.
Yeah. So we have had a number of yoga teachers on our series, and Matthew Sanford is an amazing yoga teacher that I've been working with most recently. Really amazing. We actually just recorded some videos for the VA. Really, really gifted yoga teacher. I urge you to check out his work. He works at Mind Body Solutions in Minnesota. They have a lot of free offerings. Nikki Myers is another amazing yoga teacher that I've been, enjoying her work. And then Richard Rosen is a local yoga teacher to you guys. And I'm a huge fan of Richard, who also has Parkinson's. And he's been part and parcel of our trying to get yoga teachers to understand about Parkinson's disease. Reading a little bit of different sorts of things. This book has been great, My Grandmother's Hands. Mindfulness teachers that I've really enjoyed, Sharon Salzberg, John Kabat-Zinn, who's the founder of mindfulness-based stress reduction, Jack Cornfield, who's located up in the Bay Area. I'm a huge fan of his and have met him on various occasions, and really his work is just remarkable. Joan Halifax and Frank Osteski, they are more in the mindfulness space, but also thinking about, end of life and palliative care issues, just really fabulous. So, so I think there's a lot of things in the mind body space. So then getting back to that social connection. So I think it's important to think about, how you can connect on a regular basis. And sometimes it means getting a little bit out of your comfort zone. So if it means, connecting with a support group online like this, maybe making a friend or two from here, and, maybe you could make a list of folks that are feeling lonely and give permission to each other to maybe call each other, or a phone tree or something like that. Something that you guys can create within your own group that connects your own members, I think is something that we've, been trying to spend a little bit more time affecting change in your own neighborhoods. Exercise classes or religious spiritual groups that might be meeting, trying to connect with those sorts of folks. If it's, just to give you an example of my Saturdays. So after this, I will be jumping on to a Zoom meeting with my family, and my parents live in Canada. All of us live all over. My sister lives in the Bay Area, and this my other sister in Denver, and I get to see all my nieces and nephews. And we literally have been reading to each other, and it's something that I'm very consistent with. So we have to do this every week. It's like everyone has to show up, and my boys, they have teenagers, and they have to watch their cousin, and we get to do things as a family. So it's like something I protect religiously because it's something that means a lot to me. So we're helping my nephew read. We're celebrating little birthdays throughout the country here. My niece here on her birthday, and it really feeds our souls. So here's my nephew feeding me with his Kit Kat on Halloween, and my parents and their various garden growings. Here was a competition of who picked what in the garden, okra and various chili peppers, and so I think you figure out ways to make your happiness happen, right? So it's not ideal. I haven't seen my parents, who are aging in over a year, and they haven't seen their 2- and 3-year-old grandchildren, but we're trying to make the best of it. So I urge you to think about ways that you can do the same. And so for me, therapy has also been around connecting with patients and bringing resources to them, as you guys are doing here with this group. And so we've had, like I said, over 70-80 speakers with just an amazing array of really just fabulous folks talking about everything under the sun. So all of this is on YouTube and linked here. So I encourage you to check out our, various videos here, including like David Leventhal, the founder of Dance with Parkinson's, all kinds of folks. So, check out our offerings. We've also been blogging once a week with Mike Oken, just to keep patients, updated on the virus, just the vaccination campaigns and, other things that are really resonating in our populations. So last minute or two, I don't know what time it is, really want to just spend a minute talking about self-care for everyone. So it's
You're
been
good on timing, by the way. We're at 20 minutes after the hour, so 10 minutes
cool.
or so.
Yeah. So self-care for all. So thinking about our caregivers, I know I saw a bunch of you answering the poll. So there's a number of you out there, and we see you, we care about you. We want to make sure that you're supported. So important for you all to think also about your own wellness. And so, like that oxygen analogy on the plane. So if you don't put your mask on first, you can't take care of others, right? And when I painted that picture of Judy and her life, I think her life changed dramatically, as with many patients and their caregivers with the pandemic. And so, a lot of you are dealing with things all day, every day alone. All your sort of, respite things have been taken away, and some of the fun that used to have with family has been taken away, and the things that you really look forward to. So we do understand that that's been a huge change. And so I think if you need help, if you're feeling desperate, please reach out. I think this type of group is very helpful, but sometimes it gets quite difficult for even us in healthcare. I mean, I've given this talk to people, and people have reached out to me and said, I've been feeling really desperate, feeling like I really can't live like this anymore. And so, there are a lot of people that are feeling this way. So you're not alone. Make sure you get the help that you need, and take the time and energy for yourself that, you need as well. So your diet, your exercise, your sleep, your alone time, your mind-body approaches, all important. So it's also important to, I think, be kind to all of ourselves. I give this talk to not just our patients and care providers, but even to my own healthcare providers that are, my colleagues. And, this is a slide that I think resonates with a lot of people. A lot of us are dealing with multiple needs of everybody in the world, right? So I have 3 children. I'm like the daughter of parents that need to get the vaccine, and, lots and lots of people to support in the world, and my patients as well. So each of these could be, a full-time job, and we're really expected to do it all, right? And do it perfectly. And I think some people, when we're not seeing each other, they have this aura of being perfect and being able to, cook all the New York Times, whatever dishes and one dinner, and host a Thanksgiving party for 2 or whatever, and post their pictures. I don't know what it is, doing all this house remodeling and repainting their garage 7 times or whatever, and colleagues that are publishing books and papers. But, for me, I think it's really about, figuring out what makes sense for me, taking the time, taking breaks, taking the sense that this is a marathon and not a sprint, right? So really giving permission to just be okay, not being perfect, not really, kind of just getting by sometimes, if it means having a bowl of cereal for dinner, I think it's okay. So, I think it's important to think about that, because really this past year has been all about a whole host of emotions and a mix of things that are really affecting all of us. And this was a cartoon that I did with Mikhail Moskowitz, who's a gifted psychologist, and she also draws cartoons. And really we're thinking about why is it that we're feeling so emotionally exhausted, and really thinking about just all the things that we've all had to feel. So grief, there's been shock, there's been foreboding, there's been exhaustion, but there's also been some positive things as well. So some of the most exciting things as a team that I've ever had have really happened this year. And I've just seen a lot of people rise to amazing occasions and help each other. So, I think it's just cool to kind of think about this. Additionally, I think it's important to spend a minute just talking about certain populations. And I think some of the things that we've not done well in care. So one is that I think women particularly have had a lot of the burden of this pandemic. And there's a lot of guilt, a lot of sense of balancing multi-generations, feeling overscheduled. Women have unique issues if they're a Parkinson's patient, because often their male caregivers and other folks are not able to really be prepared. So we have to think about this a little bit differently and help our women with Parkinson's communicate. So there are women-specific Parkinson's support groups that may be something you might resonate with you, or you might find a way to have the women in this group kind of just kind of parcel out in a breakout room and talk about specific issues if that's something that people are interested in. I think there's a hope that we will study this population more because most of our research has been done on affluent men that are married, that are white. And in 99% of our studies, this is the population. So it's really, we don't have a lot of information about, issues with women that are specific to their hormonal influences and things. And, especially, in this day and age, if you're in there's a huge amount of disparities for even race. And I did a program yesterday with a woman who's actually based at Stanford, who's doing some research on access to things like deep brain surgery and being involved in trials. And I think there's a lot of issues with, unmet needs of populations. And I think COVID has hopefully let us understand that there's, these discrepancies. And I think it's an opportunity to sort of pause a little bit. And for me, just thinking sort of the way that I do, I always think about, yes, there's a lot of stuff and there, it's been a horrific loss and tragedy, but I'm trying to see if there's silver linings that might be something. So for me, it's been, maybe take a moment. I used to travel a lot, give a lot of talks out of the country, go do meetings nonstop. And, I've been home a lot more, just enjoying my boys. My boys are actually musicians as well, and enjoy listening to them. And my little guy's a drummer. So it's been fun to listen to his up close and personal, drum lessons and stuff and whatever, it's fun to listen to them jam. But, just thinking about nature a little bit, Mother Earth a little bit, the things that I've really taken for granted. And, realizing that we're all connected, whether or not we realize it. So a virus that starts somewhere across the globe can affect me here. And my wearing a mask can affect my neighbors, so all of this really, we are so much more interconnected, and this, kind of connection can really play out in our health. And then also just thinking about the inequities in healthcare. I think we hopefully can work together, with the sort of resources that we have in our communities, and hopefully your support group may be able to talk a little bit about these issues amongst each other about, these social inequalities, engaging people of different, ethnicities in your own group, maybe having space for them to meet each other. I don't know, thinking about ways to break down the barriers of isolation and, issues with getting care. And really thinking about even things like palliative care. So I do have an interest in this. I showed you a book there by Atul Gawande, who's a remarkable writer. But, I posed this sort of case study, and I talked to you about Judy. And, many of the times we don't really think about what happens if something happens to Judy, right? Like what do we do? And, in these settings. And so I think this COVID-19 has really made us realize that anything could happen to any one of us at any time. And so when we focus on the treatment of Parkinson's patients, and not just their specific disease and what they want for their own goal of care, but also what happens if something happens to their loved one, or what are sort of the ramifications of that. So I just wanted to, I think this is my last slide, just talk to you about this paper that we wrote about, hoping for the best and planning for the worst. Sort of the thought of opening our minds a little bit to, palliative care approaches and advanced care planning, because I think, we realize that so much is unprecedented and unpredictable. And so if we can plan, if we can get things in place, it's better for all of us, I think, in the long run, to just have our hopes and our understanding of what health means to us, what our quality of life measures mean to us, what really gives us, joy. And then if things end up in a different sort of way where we get sick or something else happens, that we have plans in place so our wishes can be really realized. So yeah, so I know this talk was a little bit all over, but hopefully you understand kind of where I'm coming from a little bit in my approach to health and wellness and care. It's all kind of mixed and mingled. It's sort of a bit of a holistic approach, but maybe we can take some questions, I guess, from the group. Is that?
Let's do that. Let's do that.
I'm gonna stop sharing. Okay.
That's a lot of terrific information, a lot of good content, a lot of good resources. I do believe you might have set a new land speed record for a number of slides covered in an hour. So congratulations on that. I'll start with one quickly here on a specific herb. So we talked about herbs as part of the holistic treatment. What do you think about mucuna? Didn't see that in any of the slides, but
yeah, it is in one slide. I actually wrote it down. So mucuna is an interesting thing. So mucuna basically is like a sort of an approach, like a kind of a plant-based approach to replacing dopamine, and it does have dopamine in it. It is a harder way to get it, and dopamine, and it's also a harder way to know how much you're getting. When we give Cinemet, we give it with, carbidopa and levodopa. So the mucuna just has the levodopa in it. The carbidopa, which is the thing that prevents the peripheral breakdown of dopamine, is not in the mucuna. So you need a higher amount to get into the brain, really. So it's much harder to regulate. I think in some parts of the world, we don't actually have access to Cinemet or levodopa preparations. In those places, I think it's fine to take it, but I personally wouldn't use it in place of, the current levodopa preparations that are cheap and, easily gotten here.
So Sue and I will alternate back and forth. So Sue, you're on mute, but take it away. Still on mute, Sue. Want me to grab one?
Sorry, I was on mute. Does it make a big difference if I see a motion disorder specialist versus a neurologist who sees many PD patients?
That's a good question. So I think that, we've been, I think these days, the fellowship definitely has a lot of benefit in the sense that you learn about deep brain surgery and programming of deep brain surgery. You also see, as a movement disorder specialist, as we're training them, and I'm the associate fellowship director here, so I know sort of what goes into this. It's like usually a 2-year fellowship, and you see the Parkinson's plus disorders. So it's not just the Parkinson's, classic Parkinson's disease, but a range of other disorders that can look like Parkinson's. So I think you kind of get this sort of sense clinically of taking care of a broad sort of spectrum of patients in different sort of settings. I think there are a number of people that have just really loved Parkinson's and have kind of gotten their own sort of sense of it. And I wouldn't, it would just depend on their individual sort of access to knowledge and, maybe engagement with the sort of current, sort of developments. I think, I wouldn't say that it's not a board. There's no specific subspecialty exam or anything that you have to take, and there's not even an ACGME sort of regulatory body that's looking to standardize the fellowships. It's a little bit more like most of them occur in certain academic centers. But I would say it's reasonable maybe to check in with a movement disorder specialist if you have access to one, maybe once a year. And I really enjoy working with other docs in the community that are neurologists that love Parkinson's, so that we can kind of educate each other. Sometimes they see things that I might not see. And so then, we can kind of work together on the same patient, but I just check in with the patient once a year. And sometimes, because we're a center, there might be trials that we're doing or other sorts of things that may not be as available to other folks.
Okay, good. You do have one slide that touches on the gut. One member is curious to go a little bit deeper. Please address the latest thinking on the connection of the human biome and PD. What role can diet play in slowing progression of PD? I think that we covered some of that with Dr. Mishley, but they may have missed that one. So if you don't mind.
Yeah, I mean, I think it's a really, really hot and interesting area. I still am, every day there's a new trial that comes out or new information. I think the gut is tremendously important in any, honestly, in health, because the gut microbiome is a huge area of chemical release and entry portals and things like that for all kinds of stuff. So I think diet is huge, right? So what you eat is what you are. I think your mom maybe talked to you about that when you were little. I think overuse of things like antibiotics for willy-nilly reasons and trying to over sterilize things and over change that sort of makeup of not just the micro. And actually it's interesting because the microbiome is not just in your gut, right? You have a microbiome even on your skin. Like there's bugs that live here that prevent all kinds of things from happening. So I think, the human body and its interactions with the sort of environment, if you like to say, I think that there's a lot that we don't know there. And I think it's a huge opportunity of intervention. But I think what we do know is that, there is actually things that happen in your brain can affect the microbiome too. So if you watch, like Malu Tanzi did a video for us on the PMD Alliance series, and she talks about inflammation, and what they show is that stress can actually affect the bugs that live in your gut as well. And not just, it was interesting because we were talking about, Parkinson's patients have a certain gut microbiome, but even their caregivers who may be under stress, they have a different microbiome than somebody who may not be a caregiver. So, I think even stress can affect these things, just as, disease changes and things like that. The gut is also important, given the fact that A lot of our patients have constipation as a prodromal symptom. So, there's changes in the gut that affect gut motility. And so I think as even before we even diagnose patients, something is awry there. It may also be a possible place of entry for whatever causes Parkinson's. People have talked about, is there something that comes in through the gut, comes up the vagus nerve into the brain? And I'm open to learning about all of that stuff, and I've tried to keep up to date. I just don't think we have all the answers yet. But I think, eating a healthy diet, trying to, keep the bowels moving, keep hydration on, I think those are going to help all of the above. So
it seems like there's got to be a cartoon or some sort of imagery out there of gut versus stress versus over prescribing Western medicines and all the disasters that can come from that. But
you can make one. I don't know. I don't know that that's going to be that well loved by the pharmaceutical companies, but maybe there is. And certainly we know that, we have a virus, right? COVID, and vaccines work. So it's not like all that stuff is a bunch of nonsense, but I think we have a knee jerk to just take something for everything that happens. And so I think we have to just think about how it affects these other body systems and in the long run. So.
Mm-hmm.
Here's a question that's been there for a while. How can a person do mindfulness meditation while having an active set of leg and arm tremors, especially leg, which are very distracting?
Yeah, so I mentioned that, for me, I think some people are good at being able to sort of be meditative in a place with their eyes closed, and have, an app or something that guides them through. That's one way to have a meditative experience. But I think for a lot of other people, I don't personally think it has to just be in that type of space and with that very fixed sort of way of looking at meditation. So I think that, you can have meditative experiences in many other things. And so like something that could be simple is just go out in your, let's say, garden or somewhere that's accessible to you, and maybe think about the five senses sort of meditation. So, you think about, what am I seeing? Pick a beautiful thing and maybe focus on that, the intricate petals on a rose. And then, what am I smelling? Maybe it's the eucalyptus tree, right? And some sort of special fragrance that's there that day and the wind is blowing it. Maybe it's the sound of your, the sort of, but you're just focusing, you're sort of trying to take your mind and focus on one thing. And you probably do much of this in the day, but you kind of don't even realize it. But I think taking that time out to do it. So the sound of some sort of pods breaking under your feet, or if it's, fall, the sort of sound of the leaves, then, the sort of feel, maybe take your shoes off and sit in the, in the grass maybe and feel the grass on your feet. I think that these are things that are literally super simple, and people think like this is like you have to go to some special place and pay a bunch of money to like enroll in some course. I think these are just very, very simple practices. They even have a whole mindfulness meditation around, it's part of MBSR. You take a raisin and you literally sit there and you look at the raisin and smell the raisin, and then you put it in your mouth and you feel it on your tongue for like, what does the raisin feel like? And you don't bite it, but you feel it. And like, it's this whole like sensory thing for like 5 minutes of sitting there, trying to explore a raisin, which is something that you've probably never spent as much time thinking about, right? But like, it's just a sort of process of kind of disconnect from the rest of it. So I think, if you're having tremor, maybe it's something like, going out and sort of experiencing something, maybe doing some breathing with that sort of nature exploration, and sort of seeing, maybe you're going to realize that it calms your tremor down a little bit. Maybe you're going to realize that your mind may be a little sort of less anxious, things like that. So I think whatever you can do. And, honestly, with tremor, a lot of yoga actually, sort of some of the things where we're grounding. So you're sort of, feeling the feet, connecting to the ground, or, trying to sort of think about these sort of movements to breath. This can actually be very helpful to the autonomic nervous system, which is not great in Parkinson's patients, and all honestly fired up in a lot of us due to stress and things. And so that breath work, can really affect the sort of parasympathetic nervous system, which is really going to help sort of with the calming, relaxing sort of thing. But I think, again, it doesn't have to be just sitting. And sometimes what happens is you especially if you sort of are stressed because you're not calm, and then you're moving more, is that then there's this feed forward, like I'm tremoring. Why am I tremoring? I wish I wasn't tremoring. And then you get into this sort of like anxiety and more tremor, right? So I think distracting from the tremor and just maybe focusing on, the external environment, like the nature or something like that, can be helpful.
That's good. I like that. I can relate to the tremor being a distracting element. I do meditate, and I'm trying to find ways to focus on the practice and not the body, even though part of the practice suggests listening to the body and getting in touch with the body. But adding aromatherapy or auditory therapy might be
Yeah, sometimes the audio can also help. So listening to a song you love, or moving, even dancing to a song you love, can be kind of fun, and then you sort of don't focus so much on the shaking. And remember, shaking, I mean, I think people spend a lot of time thinking about like tremor and how bad it is for them, but honestly, like, it doesn't have a correlate in the brain that's bad. So it's not going to injure you. It's just annoying, but there's not really like, it's not like a seizure. It's not like something that is really going to harm you. It's more of something. And then the more you stress, even like a good stress, a bad stress, if you won the lottery, you're going to shake more. So I think people focus on it less. And especially if you focus on it less, I think it can automatically sort of feed into like, a distraction situation where you probably will end up tremoring less.
Here's an interesting question from one of our listeners. It's a long question. It's well thought out here, but I'll try to summarize. What if socializing increases PD symptoms? Have you, and I'll just summarize the rest of this to ask you, have you ever experienced anyone in your practice that has come to you and said, socializing adds more stress to my life than I care to add?
Yeah, so I think, again, this is, I think, is this Garrett's question?
Yeah.
While socializing is important, I find that socializing increases my symptoms. It sends me to an off state. Therefore, I do not want to have people over, go to others for dinner, or travel, as stress, even in positive activities, triggers symptoms and beats the medicine. So I want to avoid these things. I was extroverted and sociable before PD got worse. PD got worse. So yeah, I mean, I think, again, this comes to that sort of notion that you're sort of visibly having a symptom, and that is then sort of stressing you out to feel a little bit more like maybe there's a stigma or an embarrassment with that. And I think now what I would say is that these online sort of portals are kind of exciting to people that are like that. So you can keep your video off if you really want. I would just sort of try, and then getting on the phone maybe, or even on a Zoom call with a friend or in a support group, and keeping your video off, I think, is a really inviting way to start, socializing again. So I think, and the more sort of feeling that you can be in a space that you trust the person and that you're not self-conscious, I think it'll automatically feed forward to you wanting to, maybe connect more in person. But I think, what the pandemic has done is give us a lot more video and telemodalities, which have actually been very inviting. And a lot of the current yoga and mindfulness sort of groups that and trainings that I've been going to have really been talking about accessibility. So accessibility in the sense that some people don't feel comfortable in different spaces. So it may be that, if you're living in a predominantly white neighborhood and you're a person of color, you may not feel like people in the room may be exactly sort of able to, you don't feel comfortable in that space. And so having, accessibility thoughts around, maybe color, or, a disability, or, somebody who may feel like they're a lot heavier, for example, physically, weight wise, or they don't look the same as other people, or whatever, may normally embarrass them to go into a yoga studio and practice. But now with these online modalities, I think it's actually invited more people to feel, and there's actually a chat around that in the yoga community that has actually embraced some of the ability for that to be a way to connect more people to some of these practices that actually really need them. So I've been really much more open-minded to thinking about meeting people where they are. And if that means that you, Garrett, you're on this group, but you keep your camera off, or you meet with some of your friends from 5 years ago, and you're still eating, but you don't have your on camera, or you only show some part of you, or you have, your photo instead of you, but you're still able to talk to them and get some sort of connection with them, I think it's still a win, right? So, it's, I think, it's for everyone. But I think, again, it's that self-consciousness. So you sort of feel like you're moving a lot. or the dyskinesias are coming out a lot when your anxiety or your sort of, it's really sometimes even an endorphin or an adrenaline thing. So people then move more and then they're like more embarrassed. And they're like, I'm excited to see you, but then I'm moving more and I don't want to embarrass all of us. So let me just stay home because I don't want to come to dinner. And that's really a loss for even the other person who misses seeing you, honestly. So I think, talking, again, communicating, right? Being like, it's not that I hate you or that I don't care about you. I don't feel comfortable in that space. Can we meet somewhere else? Can I meet you in my backyard? Can you come by, come on the side gate? We can meet at this time. It's usually the best time for me. And, I might not feel so hot. I might have to go take an extra dose, or I might even have to lie down because it's exhausting. But even seeing you for 5 minutes would make my day. Was that okay? So I think just talking to people, most people are going to want to, be part of that conversation. And I think disconnection and not talking to people and poor communication. I don't know how many times I've talked to people and they finally let somebody who they've kind of blocked out. And this goes back to that sort of finding your friend, finding your tribe, finding that person to, who's going to be your cheerleader conversation. So many people feel like they have to tackle this disease by themselves. And then they cut literally everybody who cares about them out of their life. And then at some point they're so isolated and then they really need help or something to be different or some advice or whatever. And they literally don't have anybody they can talk to. And then you as a doctor are like, but you're a cool person. Like, why don't you have anyone that, like, I know that you had people that you cared about 5 years ago or 10 years ago, because I know that about you. And, and then they're like, yeah, I did, but I didn't want to bring this with that, there's so much with this disease. I didn't want to do this to this person or that person. And so they cut these people out. And then you literally those people are then wondering what the hell happened to you, right? They miss you, they love you, they want, and that's actually an affront to them that they feel like maybe they did something or they offended you, or this is a loss for them. It goes both ways. So I think taking the opportunity, and I think COVID has done that. I literally this year, I showed you some Zoom, I reconnected with people that I knew from grade 6, and had hilarious conversations with people. And a lot of people have had a lot of things happen, right? When I graduated from med school, so it wasn't yesterday. So these people are people that have meant something to me for, 30 years, 40 years, whatever. And it's kind of a beautiful thing to know that we have this whole group of people that we kind of forgot about, that I just would send a Christmas card to once a year, right? But if you call them, sometimes you're helping them. You as the Parkinson's patient are the more healthy person, the more able person, the more mentally well person, and you can actually give something back to that person. So don't discount your ability to be engaging and interesting and part of society.
So socializing is still highly important, to summarize. And even if you feel like it might be worsening symptoms, give it a try anyway. Easy.
Try even on the phone.
Start small, get creative about alternative ways to meet. Good, okay. Sue?
Here's a quick one about prescription solutions like Ambien or for sleeping or Valium for anxiety. Any thoughts on that?
Yeah, I don't love either of those drugs.
Okay.
Benzodiazepines are not good for patients with Parkinson's disease in general. That's what the Valium stuff is. Ambien similarly can cause people to be a bit confused. So neither drug would be something that I would urge people to go on. If you need something, sometimes melatonin. I see a question here about melatonin dosage. So,
Bless you.
sorry, 3 milligrams to start and maybe going up. Sometimes people need 9, 12, it depends, but talk to your doctor about what dose would fit for you.
Just before bed, probably, right?
Yeah.
Thank you.
Okay, why are probiotics not recommended?
Well, I think we don't have great studies on them. And so it's not that we don't recommend them, but, I think they're at a cost. It's hard to standardize these studies. And I think that there's been a push to, I think some people will eat a bunch of, not to bag on McDonald's or whatever, Burger King, but, there's sort of a tendency to say, no, my doctor told me that I should do something better about my gut. Let me eat a bunch of crap all day long, not exercise, and then I'm just going to take a probiotic. Like, that's not going to help anything. You have to really go from,
Don't make it a crutch.
Yeah. So I think modifying diet first, seeing how that affects your gut, and then sort of if you need something extra, I think probiotics would be a consideration, but I think it has to be diet first.
What about, there's so many things to do and learn, it feels overwhelming and sends me back into apathy. What advice do you have for pacing yourself?
Yeah, that's a good question. I think sometimes there's so much out there, right? And I think that we sometimes overwhelm our patients. There's like, now there's 80 videos that I just told you about that you can watch on the PMD Alliance thing. So I think, again, taking small bite-sized pieces and, starting slow. And, sometimes it's just, the thing about apathy is that it's really about getting started. So anything you can do to just start by putting one foot in front of the other, if it's going for a walk. So I think that starting just by walking in your neighborhood, it's cheap. Sometimes you might run into your neighbor and you can wave, these little small things with socially connecting can be helpful. It gives you some sunshine, and just going for a walk for 5 or 10 minutes, see how you do, figure out a bite-sized piece. I think that is something that I think any one of us hopefully can do, depending on hopefully where you live is safe. But, I think that would be where I would start, is something as small as that. All these other things, I think once you get more in the groove, I think you can kind of see, but there is a lot out there. I'm overwhelmed myself. I mean, there's just so much mindfulness, yoga, this, that, trauma, like all these things. There's like free courses for everything. And it's almost like everyone's trying to help everyone. And so it's great, but it can be overwhelming. So why don't we say, just start with 5-10 minutes of a walk every day in your neighborhood, get out in nature a little bit. I think that would be simple.
Great. I have one that came in offline that I'll try to, it's a little bit off of your topic, but it's quite relevant to our COVID time. So I'll try it on you and you can punt if you care to, but here we go. The state of California's COVID vaccine guidance says that healthcare providers can use their judgment to vaccine people ages 16 to 64. So to summarize, do you think people with PD will be able to use this qualification to get the vaccine?
Yeah, I hope so. I mean, I think that everyone should be vaccinated. I see everybody. My sister said every Tom, Dick, and Harry seems to be getting vaccinated right now in California. So we're still trying to get my parents' vaccines in Canada, and like the age cutoff is 85 there, which is kind of frustrating. But yeah, I think that if we can, I just want to get all our patients vaccinated. I think it'll change their quality of life. It'll change their ability to get out and socialize and get back. So I think that Parkinson's is a reasonable reason. I think what we did at the beginning was to not scare our patients, right? We were like, oh, just because you have Parkinson's, like it's not like asthma where you get COVID and you're gonna, be at this high risk of death or whatever. So I think we kind of underplayed the risk, but it's still a risk. And if you get it, it can worsen your Parkinson's symptoms. The sense that we're isolating people and sheltering them in place has been the safety mechanism that we've had to date. But I think if we have a vaccine, I got vaccinated as soon as I could get it, I would say try to get it. And if your doctor can help facilitate that, I would definitely say that Parkinson's is as good a reason as many of the other things that people are writing down. So get it.
Okay, great.
A couple questions came in on CBD oil and other essential oils. Any comments?
Yeah, I mean, so CBD oil, I don't know if people mean taking CBD for symptoms of Parkinson's and ingesting it or whatever. I'm definitely not super knowledgeable about that. And I work at a federal institution. So I'm actually not even like in the VA. I'm not supposed to talk about it and stuff like that. I think, my take on reading about, cannabis type preparations and stuff is that, maybe there's a role in sleep, maybe in pain. But I think, it's not, it's not the cure all for everything in Parkinson's. I certainly don't use it for tremor. I don't generally prescribe it. So it's not something that, but I think topically, I've seen people use it for joints or certain pains and stuff. I have, had some experience with that. I think that that's pretty safe because it's not going to absorb very well and cause systemic side effects. Other essential oils, I mean, I think you were talking about aromatherapy and other oils that sometimes, lavender, things like that can help with sleep. I think certain oils can help with relaxation. So again, I think getting them from a trusted source, make sure that you're, using them as, directed. I think some people use things in the wrong way. They're like, oh, like this looks like it's supposed to be good for me. And they'll ingest it when it's supposed to be, in a diffuser. So make sure you're reading packaging and things, but I'm open-minded to a lot of that kind of stuff. I think the sense of smell can definitely be engaged in, relaxation. But it doesn't have to be expensive or anything crazy. You can even use your own herbs from your garden and, put them in, some sort of oil and maybe, smell them or whatever. I don't know. You can probably come up with cheaper solutions. Cause I think some of the stuff that people are asking about is the fact that some of this stuff seems inaccessible. Exercise programs are very inaccessible because of cost. And I do agree that we do have certain things that are inaccessible. I think when we talk about wellness and we brand it with, pretty yoga pants and expensive looking yoga mats and very expensive studio memberships, I think we have done a bit of a disservice. A lot of this is supposed to be free and available and, part of a lifestyle that you should be able to very easily approach without added cost. So my hope is that people can walk, which hopefully is free. Hopefully get some online apps that are, free. There's a lot of free yoga content out there, and certainly not trying to get people to get expensive, equipment. Some people use the expense to motivate themselves. I know I have friends that have got the Peloton or whatever, and they're like, I spent so much money on this thing, I'm going to use it or whatever. So if that motivates you, then that's, kind of your, I guess, carrot or stick or whatever. But I think, most things that I've talked about on this talk are actually quite free and available.
Yeah, there are a lot of videos out there for good yoga exercises. My daughter has dragged me into her yoga practice, which is just on the back patio and the laptop with a YouTube video.
Yeah, exactly.
And
I mean, in these discussions, we do miss out on the people that don't have access to internet and, some of the technology. Some people are not as savvy. You guys have already made it here, so you know how to connect and stuff. But, I think if you know of other people that are in your group that don't have access, maybe try to include them, maybe drop off a tape or a video or whatever, something. Think about people who may not even have access to even this type of technology.
Here's a more global medical industry question. Now, why do you think more doctors out there are not embracing holistic and integrative medicine approaches today? And do you see that scale tipping?
I hope so. I mean, this has kind of been my place to speak from for a while, just because I had my own sort of personal and medical things that I, have treated and helped work-life balances and stuff with these things and seen, anecdotal benefits in myself. So I think, first of all, the healthcare system that we have is pretty antiquated, right? So, and it's very insurance payer based, and, the models of care are, very, very, specific to insured populations of certain affluence getting the best care. So I think, we have to, when we think about, even this question, I think we think about the more holistic question of like, what is wrong with our healthcare system, from the get-go. We don't get a lot of exposure to these sorts of chats around integrative medicine or even this lifestyle stuff in medical school. So you have 4 years to educate somebody. I literally didn't hear about real diet, sleep, exercise that much. And I went to a pretty decent medical school. Certainly mind body, like none of this stuff was emphasized at all. And the lifestyle stuff, it's always about, you have a disease, here's the cells, what they look like under a microscope. And then we give this thing to get rid of those cells or that disease process. It's not really about, sort of more of a holistic approach. So I think it does require a bit of a realign of what we think of health and what we think. And there is a group of doctors that are heading towards that. Many people don't start out being that doctor though. Like it wasn't until I practiced medicine for about 10 years and I was like, I don't know that this is actually really helping everybody in the right way that I want them to get helped. So I sort of saw where the deficiencies were and have been kind of exploring these other things kind of on my own. But, there's not really a mechanism easily in our current sort of paradigms to train people. You want to do an integrative medicine fellowship, it's like $15,000 out of your pocket to get trained as a doctor. I mean, that's ridiculous, And
you have to do that yourself after med school.
Yeah, after med school. Yeah.
Self-education. So are there educational channels post-med school for non-Western and non-traditional?
Yeah. Like this fellowship, like I told you about, the one that I just told you, many people are already in practice and then they can take it. That's on their free time at that cost. So if they want to learn and really be able to practice it, that's 2-year fellowship for that. So I think, again, making it more part of the baseline medical treatment training, and then making it cheap and accessible, in ways that doctors who are interested can get trained without having like this huge cost, So I think, again, it's really, from the ground up, but I think there are people, and like, luckily, like Lori and I, we work very closely together and we see, really enjoy the sort of dialogue of her approach and my approach, and we kind of meet in the middle. I think more of that open-mindedness needs to happen.
And collaboration. Okay, well, we're getting close to the end of our window here, but one question that we pretty much ask all of our medical professionals, our caregivers, and our doctors that join us, almost regardless of the content of your delivery and of your presentation, is do you know of any promising treatments, Western or otherwise, out there that are in research now that we can look forward to learning more about soon?
Yeah, I mean, I think, that's a pretty complex question because I'm obviously not, a basic scientist looking for, sort of disease modifying therapies. I think for me, I really think right now and with COVID, my mental sort of state is, and we're just starting, just so you guys know, there's a group of us that are on, sort of outside of, the normal channels, including a psychiatrist and some other folks, and trying to sort of think about, certainly health and especially these mind-body health kind of approaches and wellness as sort of a little bit more of a forefront of really helping a wide population of Parkinson's patients and getting better resources. Because the problem is, I think much of this stuff is confusing. So we're putting together a website, and I mean, we can link it here, but it's password protected right now. It's called www.pd and then like a /wellness.org. And I just started tweeting under this similar sort of, actually I can probably type it in here, a hashtag or whatever, or handle. And so we will, stay tuned. We will hopefully have, some resources there. But I think, again, for me, it's really about helping people to live a better sort of life, wherever they are right now with the disease, and not sort of looking and seeking for something that's outside of what they have control over. I think when people are able to modify things in their day-to-day life, like exercise, like diet, like, these social connections, like wake up in the morning thinking, what can I do to help myself and to help others with the same problem? I think there's a mind shift that goes on there where it's less about a victim sort of role of like, why did this happen to me? And then feeling negative about it, to like, a more proactive sort of empowerment and kind of engagement sort of role, which I think I really would like to see more patients getting to, in that space. And I think we don't do as much as doctors in that space that we need to, because I think that sort of role of, education empowerment is so key for people to succeed. So I just put it in the chat, and then I think here's I'll just put the Twitter handle for those of you who are on Twitter. And then, yeah, I think that's our Twitter handle. I'm not mistaken. It's all new. So, and then we'll hopefully be launching, I think we're going to be launching around the Parkinson Awareness Day kind of time frame, but we're getting good content, some blogs, a lot of the videos that we've already done, and hopefully getting some more content, getting forward, and hopefully hearing what patients want as well in that space. But it sounds like just from this chat that you guys would be interested, and we'd love to have you kind of go on there and share our words and messages. So
yes, we would. And we are at the top of the hour, in fact, a minute beyond. And the last thing we want to do is keep you from your family's Zoom calls. So.
I'm trying to protect that time, because otherwise they all take off. I usually do it from 11 to 12. So yes.
That's one of the important takeaways in this whole thing, is that we all should protect that time. So you already see the thank yous flowing in through the chat. So
yeah, thank you so much.
Sue and I, on behalf of the rest of PD Active, extend a huge thank you for all this great content and excellent resources. I promise we didn't get to all the questions. I'm sorry about that, folks, but we will be posting this recorded session on our YouTube channel before too long, and the presentation itself, which has all those great slides on references and resources toward the end of her presentation.
Thank you for being such an interactive group and having me. I really appreciate it. And it's good to see you all. And we look forward to, you guys can join us too on our the other support group. The more the merrier, and it's always fun to kind of combine resources a little bit. But very best of everything to you all, and hope to see you soon.
Thanks so much. Bye-bye. Thank you. Have a nice rest of your weekend.
Thank you, you too.